In this final chapter of the series, Dr. P, can you talk to us about the surgical approaches to the treatment of AFib and that abnormal rhythm called atrial flutter?
Be delighted to. There are surgical approaches to the treatment of atrial fibrillation. They're not typically used as first-line treatment, but are available if needed and can be quite successful. These approaches can be used on a heart with the chest open, as seen in this figure, done in the operating room, called the maze procedure, or in some cases with some minimally invasive techniques that don't require an open chest procedure. If we look at this figure of the maze procedure, you can see that the heart is cut up into many parts, and that's where it gets its name, the maze. Therefore, the sinus beat that starts at the top in that little area called the SAM, which is the sinus node, takes a very circuitous pathway now to get to the conduction system and down to the bottom of the heart. By this technique, when it was developed, it was found that it makes enough cuts in the top chamber and isolates the pulmonary veins to allow a patient to stay in sinus rhythm, and this is what they call the maze procedure. I often request that a maze procedure be done when a patient of mine who has AFib is undergoing some open heart cardiac surgery, for example, bypass surgery or taking care of their heart valve. Of course, you need a surgeon who's expert in this technique. In my opinion, in a patient with AFib undergoing open heart surgery, if possible, I usually ask the surgeon to also exclude the left atrial appendage, and this tends to minimize stroke.
Okay, Dr. P, let's move to atrial flutter. What is its connection to AFib?
This is actually a very important thing, and patients often get confused here because atrial flutter is kind of a kissing cousin of atrial fibrillation. Atrial flutter results from a very organized abnormal electrical circuit, and it's usually more on the right side of the heart. Importantly, atrial flutter, especially in those 60 and older, is started by atrial fib. This is shown in the bottom of the figure. I use the analogy of starting a car as seen in the top part of the figure. You don't hold your finger on the ignition button after the car starts, but that is how you start the engine. If one looks at the bottom of this figure, you can see a heart there with two separate parts. On the right side of the heart, there's a thing I've called the engine, and that's a circular, around and around, re-entering on itself rhythm we call atrial flutter. It can occur on both the right and left sides, but typically it's on the right side of the heart. This leads to a rapid but regular rhythm. If you look on the right-hand side of this figure, you can see that there is an atrial fibrillation impulse there, and the reason I've put that in is that atrial fibrillation often starts atrial flutter. Not infrequently, patients will present only with atrial flutter, and it's important to know atrial fib is often lurking somewhere in the background. This is especially important if catheter ablation of atrial flutter is contemplated, and it's best to evaluate for atrial fibrillation with long-term ECG monitoring before proceeding to ablation of the atrial flutter.
Well, Dr. P, we have covered a lot of ground in this series so far. Do you have any final thoughts to leave us with?
Yeah, thanks for asking. I do. This is a complicated arrhythmia. The approach to the patient with atrial fibrillation requires consideration not only of the patient's symptoms, but a variety of approaches to treatment. In my opinion, it's very useful for such a patient early in the course of their disease to seek an opinion from an electrophysiologist. We're the heart rhythm specialists because electrophysiologists have special training in the care of patients with heart rhythm issues and are likely to be most up to date on all the options that are available for the patient.
Well, our thanks to you, Dr. Prystowsky, for helping all of us better understand the intricate details and treatments of atrial fibrillation. It is certainly important information about a condition affecting millions of people nationwide. And thanks to all of you for watching.
Thank you, Lindsay.